And so we're back. This segment of the Unit 5 lecture talks about diabetes, the importance of maintaining a healthy blood glucose level, excuse me, and some of the lifestyles that can contribute to developing diabetes. Did you know that Kentucky has one of the highest number of citizens who have diabetes in the nation? It's a big problem for many people, some of whom you may know or are related to. We'll also talk about other carbohydrate-related diseases as well. We learned in part 1 of the lecture that glucose is the body's major source of energy or fuel, and that the brain prefers glucose from carbohydrate sources rather than from protein or fat sources. The pancreas provides two hormones that are very important in the regulation of glucose levels in the body. Insulin helps lower blood glucose levels, and glucagon helps raise them. So these hormones perform a continuous balancing act to maintain healthy body glucose levels between 70 and 100 milligrams per deciliter. This might be a good time to watch the video Blood Sugar Regulation in Unit 5 folder. It gives you a visual description of how this balancing act works. There are three kinds of diabetes. We'll talk about type 1 first. Type 1 diabetes is an autoimmune disease in which certain cells of the immune system don't recognize the body's own insulin-producing cells of the pancreas. So what happens? The body's immune system cells destroy the insulin-producing beta cells. For people with type 1 diabetes, insulin must be obtained by injections or via a device such as an insulin pump. The pump delivers the hormone through a small tube that's inserted under the patient's skin. See the picture on the slide here. Type 2 diabetes is the most common form of diabetes. Beta cells of the pancreas produce insulin, but the body's cells are insulin resistant, so they don't respond properly to the hormone. Because glucose needs the help of insulin to enter the cell, no glucose can get in and provide energy. So let's do a little pretend to help understand what happens in type 2 diabetes. First, a person eats food that is digested and converted to glucose. The glucose is absorbed in the small intestine and enters the bloodstream. A cell calls for energy. Here's the pretend part. There's a gate in the cell that the insulin must pass through to enter the cell and help the glucose provide energy. The gate requires a password to open. When insulin arrives, the cell doesn't recognize the insulin's password, so it doesn't allow the insulin in. The result is that glucose stays in the bloodstream and blood glucose levels increase beyond normal levels. This inability of the cell to respond to insulin is called insulin resistant. People who are diagnosed with type 2 diabetes can take medications to help reduce cells' insulin resistance. Some people can even control their type 2 diabetes by exercising regularly and losing excess body fat. Diabetes can play a role in pregnancy. If a woman with diabetes has poor control of her blood glucose levels before or during pregnancy, she may experience serious health problems such as very high blood pressure and preeclampsia. Her fetus may also develop birth defects and be too heavy at birth. Gestational diabetes is the type of diabetes that develops during pregnancy. Often women who recover from this form of diabetes are more likely to develop type 2 diabetes in the future. Overall, women with poorly controlled diabetes or gestational diabetes are at greater risk for miscarriage, stillbirth, and premature birth. If someone with diabetes does not control their disease, they are at a great risk for nerve damage. Other health problems that can occur when diabetes is not controlled are kidney and heart disease, blindness, and limb amputations due to poor circulation. In the U.S., diabetes is the 7th leading cause of death. As I mentioned earlier, Kentucky has one of the highest rates of diabetes in the country. Take a look at the 2020 Kentucky Diabetes fact sheet. It may be too small to read, but you can go to the link to review the report in detail. One thing you can see, though, is that the darkest area on the map, meaning the area with the greatest number of people with diabetes, is in eastern Kentucky. Some of you may plan to provide health care for this region, so it's important for you to learn all you can about diabetes. I've posted the link of another report from the Kentucky Cabinet for Health and Family Services. Our state is very good at providing us with important health data. Part of the role of healthcare providers is making people aware of how to monitor and care for their diabetes. They should be encouraged to achieve and maintain their blood glucose levels through meal planning and taking their meds. They also should keep track of their blood glucose levels and be aware of their A1C levels. A1C levels determine a person's average blood glucose levels over the past 2 to 3 months and can be provided by their doctor. Can diabetes be prevented? Unfortunately, there is no way to prevent type 1 diabetes. However, the risk for type 2 diabetes can be reduced by becoming more physically active and losing weight. Some people may be genetically related to a close family member with type 2 diabetes. While we cannot change our ancestry, we can get more exercise and be more mindful about eating healthier cuts of meat, healthier forms of fat, and increasing fruit and vegetable intake. Just a note, that yummy squash casserole your grandma makes with real butter, cream soup, and Ritz crackers does not count as a veggie. We've talked about blood glucose levels that are too high, but what happens when they are too low? Hypoglycemia occurs when the blood glucose level is less than 70 milligrams per deciliter. When hypoglycemia occurs, the body secretes the hormone epinephrine, or sometimes called adrenaline, to increase the supply of glucose. If the blood glucose level drops too low, the brain cells cannot obtain enough glucose for energy. The person becomes confused, may lose consciousness, and may even die in some cases. This condition can happen when diabetics who take insulin shots do not manage their food intake to match the amount of insulin they take. Using an insulin pump can help with this condition. Now we move on from diabetes and look at some other health conditions related to carb intake, such as dental health. The slide here shows a recent report on dental health in Kentucky from the Kentucky Oral Health Coalition. Again, this report is pretty small, but I've provided the link for you at the top of the slide. When compared to other regions of the state, the eastern region, which is shown on the map there in light gray, has the greatest need for urgent dental care, including 20% of children. Also, the rate of untreated cavities was significantly greater in this region. As we know, sugary drinks and sweets contribute to dental caries. There is a need for both children and adults to decrease those sources of carbs in their daily diets. And of course, emphasizing good dental health at home, e.g., brushing and flossing twice a day is really, really important. There are 2 carbohydrate intolerance conditions that are rather common, especially lactose intolerance. People with this condition don't produce enough lactase, the enzyme in the small intestine that breaks down lactose into glucose and galactose. When lactose isn't completely digested and absorbed by the time it enters the large intestine, bacteria there breaks down lactose and produces gas, bloating, and discomfort. Fortunately, we have plant milks like soy, almond, and oat, as well as cow's milk that is pre-treated with lactase as choices that may ease intestinal discomfort. Another form of carbohydrate intolerance is food maps, FODMAPs. FODMAPs are a group of carbohydrates and sugar alcohols that aren't well digested by enzymes produced in our digestive tract. As with lactose intolerance, bacteria in the large intestine can ferment these substances and produce the same types of intestinal problems. This is a rather new condition that may require a registered dietitian to provide guidance because it can vary from person to person. Research continues about FODMAPs and how to best treat it. The last disease we will cover is non-alcoholic fatty liver disease. It's estimated that 25% of Americans have this disease. A risk factor is a very high intake of carbohydrates. It is also more prevalent in people who are overweight, obese, or who have diabetes. There is no treatment other than weight loss, and if it's not managed, it can progress to liver failure, thus requiring a liver transplant. As you can see, carbohydrates are complex in their structure, how our body uses them to make energy for the cells, and in the diseases caused by them. Needless to say, carbohydrates play a large role in maintaining our